The federal government is sending military and medical personnel around the country, and that FEMA support is already on its way to the Badger State.
Tonight, NBC 26's Jenna Bree shows us why a U.S. Navy team of doctors and nurses is heading to Green Bay.
If people don't really take this seriously and try to chip in to try to prevent ongoing transmission of these viruses, I think it's very likely that hospitals throughout the region are going to need some kind of assistance.
Assistance in the form of 20 U.S. Navy nurses, respiratory therapists, and doctors, an alternative to opening a field hospital.
While we were very fortunate to have the field hospital and certainly did have numbers of patients need to use it last spring, what we're finding is that certainly patients prefer to receive care as close to home as possible.
U.S. Army North says the Department of Defense has already sent 10 teams to 5 other states.
That need was determined by them to be Green Bay and to be Bellin Hospital.
Bellin is still waiting to hear details on the specific skill set of the medical team coming, but U.S. Army North says the team will be arriving by next week and they'll be getting to work by New Year's Eve.
It's unfortunate that these teams have been called back in, but again, they have the right specialties to deal, with COVID and to support the hospitals.
In a statement, Bellin Health said, quote, "While we are incredibly grateful to be receiving federal assistance, the fact that we need to accept it should send a clear message to the public that we are at a critical crossroads for local health care. We must work together to stop the spread of COVID and ensure our hospitals and health systems can continue to provide high-quality care for all who need it. We cannot do it alone." End quote. In Green Bay, Jenna Bree, NBC 26.
As we look at hospitalization numbers, we can see that very few beds are available. The number of patients hospitalized has surged since this summer, but we're still below the pandemic peaks that we saw last October and November. We do also want to note that last March 2020, Green Bay hospitals were at 97% capacity with 0 coronavirus cases in Brown County at that time.